Welcome to our webinar. I'm Dr. Adrian Larsen. Glad you're all here. Today we are going to talk about how to integrate AcuGraph into your practice, or as I like to say it, now that I have this thing, what do I do with it? The purpose of this webinar, and kind of the genesis of where this webinar came from, it really is the synthesis of a lot of phone calls I've taken and made over the course of the last 12, 13 years of doing this, where people get it and they love it, but then they start using it and they say, okay, well, how do I explain it to the patients? And how often should I graph? And should I do it out in, in one spot and then treat in a treatment room, or should I just graph in the treatment room? And all of these various how should I or how do I kind of questions people ask me all the time. And so today we want to hit all of the how-to questions, because you've made a significant investment in AcuGraph. We want you to get as much out of it as you can. We want your patients to get everything out of it. And even if you've been using AcuGraph for a long, long time, we want to give you some tips, some tricks, and some insight that's going to help you even get more out of it. So that's why we're here. I am going to put up a poll right now. Everybody that's here with us, I want to find out. Let's see. Yeah, how well is AcuGraph integrated into your practice? In your opinion, based on what you know and what you've been doing, do you feel like it's well integrated as an important part of your practice? You're using it a lot, you're getting a lot out of it? Or is it something that you're still kind of struggling to figure out, how does this fit? A lot of us come from a TCM background. We're taught to use pulses and tongues. We're taught that technology is just, something that's never really entered into the equation. And so it may be a little bit of a struggle to integrate this thing. And so I'm looking at these poll results coming up here. If you haven't voted, then just pop over there on the side of the screen and let us know what you think. All right. Good. It looks like we've got a little bit of a mixed bag here. Some folks that are trying to, and some folks that are using it pretty smoothly. It looks like we can do a lot of good for some people here. Good. Okay, well, let's look at my notes and see where we're going to start first. One thing I wanted to make clear, this is not about how to design a treatment plan. Today, we're just going to talk about the nuts and bolts of using and explaining AcuGraph, making it an asset. How to treat patients, we'll talk a lot about that in some future webinars. We'll also talk about how to market. We've got a whole series of webinars that are going to be outstanding for you. But today it's nuts and bolts, how we're going to do it. So just a couple of quick technique things. Number one, the patient does have to be holding the ground bar. Every now and then I get a phone call. Somebody says, yeah, I'm trying to read and nothing happens. And they forgot to have the patient hold the ground bar. I get asked things like, what about with a baby, an infant? What do we do there? And the answer is you can have the ground bar actually held against the baby's, say, thigh, for example, and it can be held by a parent. And they say, well, won't that interfere with the readings? The answer is no, it won't. Electricity takes the path of least resistance. It's going to go from the ground bar to the probe through the patient. Even if somebody else is there helping hold the ground bar against the skin contact, it's not going to interfere at all. And make sure that when people are holding the ground bar, don't just rest it in the hand like this, but actually put fingers around it. You don't have to squeeze, but just make sure it's making good contact. It's all about surface area. You want as much contact surface area around the probe as you can get. The other point I wanted to make about the probe is that when you are moistening the probe, you want to moisten it, and then you want to tap a couple of times, tap, tap, to get the excess off so that it makes a moist circle. I covered that in the video, but the amount of moisture is important. And if you do that, if you moisten it and let it wick up into the cotton, and then you tap a couple times, you can do both wrists or both hands, and then you moisten again, and you can do both feet. And that's the technique that works really well for me. That range of moisture will go for the full 12 exam points, no problem. So much for little tips and tricks about how to use the probe. It doesn't seem like too many people have problems with that. At some point, by the way, in an upcoming webinar, we're going to do a segment on point location and precisely where we're going to go over each one of the points and help people that maybe have some questions about that. the one tip I'll give you right now is that, especially when you're new, it's permissible to take the probe and to move it around and listen for the highest pitch, the highest reading. And when you find that, that's the point. If you feel like 3 seconds isn't long enough, then you can go in AcuGraph into your preferences and you can change the amount of time for each measurement. So you can up it to 5 or 10 or whatever you need until you're comfortable locating the point. The point is the highest pitch. So much for the nuts and bolts of how to integrate it into your practice. A bigger question is, how do you know if you're getting accurate results? When you're doing the measurements, I've had a lot of particularly new users that'll call and say, well, I'm not really confident. I don't really know if I'm getting good results. And so what I'm going to do while we talk about that, I'm going to put up another poll because I want to know how you're doing. I want to know if you feel like your results are good. So just a second here, we're going to put up this one. And tell me about your technique. How good do you feel your measurement technique is? And this will help me know if I need to give people a lot of help or if we can talk about other things. But I told you I was going to answer a question. The question is, how do I know I'm getting accurate results? Number one, if you're not getting a whole ton of splits. I'll tell you, years ago when we developed AcuGraph, I used to get a lot of splits. I would do an exam and 4, 5, 6, 7, 8 split meridians was common. And when there's over 4 split meridians, spleen 21 is the point that gets recommended. And so spleen 21 was coming up on almost every graph. And it got a little frustrating, and other users would call and say, yeah, it's always spleen 21. Yeah, that's just, every patient gets spleen 21. Well, what we found out when we did a little more experimenting was that often those splits, and remember, a split is when you measure the left and you measure the right, and they're very different. Often those splits were because one side or the other, the measurement wasn't accurate. You had actually missed the point. So we put a feature, back in the AcuGraph 4 days, we built a feature where you could go back and remeasure all the splits. And people say, well, wait, I thought you can't remeasure. The answer to that question is, if you are remeasuring the low side of the split, it's low because either it's low or it's low because you missed the point, and that's why you got a low measurement. If you missed the point, then remeasuring is the right thing to do, because this time you're going to hunt around and you're going to get on the point. Therefore, what we found is that about 80% of the splits disappear when you remeasure splits. Therefore, first of all, if you're getting a ton of splits, that's an indicator that your technique probably still needs a little work, and that's part of why we have the remeasure thing. It's to protect you and fix that, and it works great. Any splits that you remeasure and they're still low on one side and high on the other, that's a genuine split. That needs treatment. Okay, another way that you can tell that you're getting accurate results is when you look at the pattern over time. What I mean by that is, if I measure you today and then perform a treatment, and then I measure you, say, in 2 days when you come for your follow-up visit, and then maybe the next week I measure you again, and I've got a series of graphs, often what you'll see is a series of graphs that have a similar pattern. Now, things will change. There's always a little bit of noise, and you'll find that the pattern tends to improve, but often you'll see that people kind of fall into a pattern and it's repeatable. And that's a great confidence boost, because you realize, yeah, look at that. This patient always seems to have a lung large intestine issue. I've had that for 4 graphs in a row here, but this other patient over here has a totally different issue, and you start to see, yeah, okay, I'm getting real results. I'm getting usable information here. So that's what to look for. You can't really just do one graph and say, oh, yeah, okay, I'm really confident I did that absolutely right. You'll get there. You'll get to where you're confident in every graph that you do, and that simply comes with experience. But for those of you that are new, for those that are just starting out, watch for those patterns over time. Okay, next I want to talk about integrating into your practice. And I see that, let me look at that poll result really quick. It says, vast majority say, okay, I'm pretty good, but I'm trying to improve. Some say I'm not confident at all, and some say I totally don't know what I'm doing. Well, hopefully those tips that we gave you are going to help. The other thing I want to tell you is practice. If you're new to AcuGraph, then get a staff member, get a family member, a friend, and say, look, can I just play with this on you? Can I just work with this? And do a few graphs. Spend a few minutes. Search around for points. It's not hard to learn, but it does just take a little bit of practice. Okay. Oh, somebody, let me take a couple of questions here. Somebody says, can I use a moisture cream to moisture my patient's skin if it's too dry to help to graph? Good question. Let me go ahead and address that right now. Most skin moisturizing creams use an oil or, kind of a greasy oil-based lubricant on the skin, and that seals it up so that internal moisture stays there. Problem is that that actually is non-electrically conductive, and lotions and moisturizing creams can actually interfere with doing a graph. So although the skin will feel moist and slick because it's got lotion on it, it may not conduct as well. So I would say no, you're probably better off, if you have a problem with conductivity, check moisture, check pressure, and on certain patients, particularly if a patient is older, because conductivity across the board tends to decrease with age, or if the patient has heavily pigmented skin, the darker the skin, the less the conductivity, and that's just nature of skin. If either of those are the case, then just increase your pressure. Increase it uniformly, though, at all the points, so that you can get good readings and good values across the board. You shouldn't ever have to push really hard, but I know that some people that are highly conductive, you just barely rest the probe and you get a really high reading. Other people, you'll have to use a little bit of pressure. Again, you'll develop that with some practice. All right. Next, let's go to integrating into your practice flow. Now that we've kind of talked about nuts and bolts and reviewed some things, let's talk about what to do with this thing in your practice. Number one question I get, where and how do I perform the exam? Should I do it on intake? Should I do it in the exam room? Should I have a dedicated room? Should I have one in every room? These are all great questions, and there is no right or wrong answer. There's a lot of different approaches. So, first of all, there's something called a dedicated graphing station. I've seen a lot of practitioners do this, where they'll have one spot in the office where the patient gets their graph done before going to a treatment room for treatment. And so you might, even if you have 2 or 3 treatment rooms, you might have one dedicated graphing station that's, I don't know, in a private office or something. So on intake, the patient comes in, they get their graph done, and then they go to a room for treatment. You can even have an assistant that does the graphing if you want, if that person's properly trained, and that way then you as the practitioner can come in, look at the graph, and actually do the treating. And now with AcuGraph 5 being network friendly like that, if a graph was performed in another room, it's going to synchronize to all the computers that you have on the network, and so, or that you have AcuGraph on the network, and you'll end up with that information at whatever room you go to. Coming soon, by the way, we'll have that available for iPad where you can carry that with you, and right now you can do that on other tablets like a Windows tablet computer, where you could do the graph in one room and have a Windows tablet that you carry, and it'll transfer over. Let me show you a couple of pictures here, just a moment while I pull those up. Alrighty. And here we go. I need to share my screen with you so you can see what I'm seeing. That's not going to work. Sorry about that. There we go. Okay. All right. So here is in this picture right here, you see what it looks like when you have AcuGraph set up in a treatment room where you can do the graphing, and this is over at Kimberly's clinic. Thanks for these pictures, Kimberly. This picture here shows what it looks like when you actually do the graphing in the treatment room. You can see that she's just got it set up on a little side table there, make it convenient to roll it out of the way. This is what a graphing station might look like. You see it set up in an office where you can do the graph on intake, for example, and then move to a treatment room for treatment. And then there's one other approach that gets used, and that is a portable graphing solution like this. Set it up on a graphing cart. And I've seen a number of people set up solutions like this that they can just roll it from room to room. If you have a laptop, then you don't have to have cords that you drag around because the laptop will power the AcuGraph. So you've got a lot of different and flexible ways to do this, and perhaps this gives you some ideas of how you can set things up, particularly if you have tight space, for example. So there are a few ways that various practitioners have done it, and hopefully we're back to seeing me again. Okay, next then, how much time should it take? This is a question I get asked. How much time will it take when I set up and actually sit down and do the exam? Well, hopefully you know the answer to that. Once you actually start an exam, it's 2 or 3 minutes to get to the end of the exam. And then there's how long you want to take to explain, for example. The point that I want to make there is just this. This should not slow down your practice day. If you properly implement it, it will actually speed things up. And here's why. If you don't have a common point of reference with something objective and something visual by which you can explain to the patient what's going on, oftentimes you end up with a lengthy explanation process, particularly on the first visit, where you might spend a long time trying to help them understand Chinese medicine and meridians and qi flow and what this is all about. Whereas if you have something visual, they get it so much faster. You can point to the graph, you can say, well, here are the 12 channels, and you can see you have a couple that are low and one that's high, and this explains your symptoms, and we're just going to balance that. Chinese medicine is about restoring balance, and so we're going to restore balance to this, and here we go. And that's it. That's the explanation that's needed. Therefore, once they understand that, follow-up visits can go a lot quicker, because it's not so much about trying to understand liver qi stagnation and the implications for the spleen. It's show me my graph, let's see how I'm doing. And so you can actually use that to speed up your patient visits because communication can be so much quicker. Now, I wanted to turn the time over to Kimberly to talk about practice flow. We'll get into explaining things next, but right now I want to talk about how does it flow. Kimberly, what do you do in your practice? Do you bring people in and you graph them at a graphing station, or do you do it in each treatment room? Explain to us what it looks like for you.
Hello. So can everyone see my face, or do I need to make a change here?
I see you.
Okay. When I first sit down with a patient, the first thing I do is open up AcuGraph, and well, I can talk about before AcuGraph and current. So before AcuGraph, there's always that time of explanation. How are things going? How'd you do on your last visit? So if you, can you guys still see me? Can you hear me? Hello, hello? Okay. So originally, I would have to ask all those questions anyway, so you can't really count that as AcuGraph time. What I do now is I open up a graph and I open up the notes, and the first thing I just ask my patient for a follow-up visit, how are things on your last visit? I take notes, I write it all down in AcuGraph, and then I just jump into the graph. So part of all of that, the graphing itself takes 2 to 3 minutes, and I'm maybe taking 5 minutes by the time I'm opening up notes and typing the information in. So that is for a follow-up, maybe 5 minutes. And then if it's a first visit, I go through a normal intake like you would any other time in your clinic. So I'm adding all of my, I sit down, I do a full intake, I talk about their chief complaints, I take all the information for a TCM exam, and then by the time I move over to AcuGraph and do the AcuGraph analysis, I might be spending 10 minutes. So I allow that 10, maybe 15, depending on how much explanation that patient needs on a first visit. But I allow an hour and a half for my first visit, so it just fits in naturally. If I didn't have AcuGraph, I guess the time change would be about 10 minutes different. And that also depends on how many questions they have and what they have going on. AcuGraph makes that really simple, and I have a flow, and I'll talk more about that as we move on later. So I think, did I answer all the questions that you were hoping for, Adrian?
Yeah, thank you. And we're going to be going back to you, Kimberly, for some more insight for how you do things in your practice. So thanks. And I'm going to take a minute. There's a couple of questions that have come in here too. So let me just read these. Bill asked, Acu5 has us repeat certain points when finished, with no choice to skip. Usually just 1 to 3 points. Does it retest the loci? Yes, it does. It only retests the loci. So pay attention. It'll, if it says to retest, heart 7 on the right, make sure you're retesting on the right because that's the low side. There is actually a choice to skip, by the way. Let me just show you where that is while we're here. I will pop that up and let's go here, look at that. Okay, so I'm here in AcuGraph and I'm in the settings under measurement settings, and you can see here that there is a retest split setting, one for source, one for Jingwell, and one for Retaraku. And I can say I want to retest my splits always, or ask me if I want to, or never. I keep it set for always because that's more accurate and that's what I do. But if you want the choice, set it for ask, and then it will ask you each time. Or you could turn it off if for some reason you wanted to do that as well. Okay, so back to questions then. Let's see. Jane says, I had an issue with screening module the other day where all the graphs were reading high. We were in Florida. It was very hot. Could that have been the reason? I seem to have no problem with doing full graphs now that I'm back in the office. Yeah, if you were outdoors at a public screening, for example, and people were hot and therefore they were perspiring and their sweat pores, their sweat glands were open, things will read higher. That's just a fact of skin. There's nothing you can do about it. Still, watch for the balance between the meridians because the overall average, whether it's a high average or a low average, that's less important than the balance between. Okay, good. Julia says, my question may be for later. Well, we'll see. But when it recommends the points, it also recommends the front and back. So do you turn the patient over in treatment? Depends on what points you're using. You get to choose the points. So for example, if you choose the back shoe points, then yeah, you'll have to have access to the patient's back. But if you don't choose to treat with back shoe points, maybe you choose to treat with some of the other recommendations. Those might be on the arms and on the legs, for example, and you could have the patient lying on the table for that. So really, it's up to you and what treatment plan you devise. Let's see, and then there's one says, I've always had this problem where one meridian will make the sound while graphing, but no number reads on the screen. I have to manually go back one spot, remeasure, and then the second time it works. Is that common? Happens about once every 7 to 8 graphs. Thanks, Brian. That's a great question. The main time I've ever seen that happen is if you're really fast. What I mean by that is if you're here measuring and you go beep, 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 and as soon as you hear the beep, you're already on to the next point. It may not capture that you lift it off. It has a chance to advance to the next point, and then you start reading again. If you advance too quickly before the software catches up, it's waiting for you to lift the probe. And so it's going, hey, you got to let go before we can take the next measurement, and it won't advance until you do that. And so people that are very quick, and that's easy to do in the Jingwells because you're just going finger, 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 finger. It's very fast. If you don't pause for a second between points, and if your computer is maybe a little slower, it's not catching up with you, that can be the main issue there. So good question, Brian. Thanks. Sedella, do you always use needles to treat the points the AcuGraph suggests? Little off topic for today, so I'll just give a really short answer. No, I don't always use needles. Sometimes laser, sometimes electric stim, sometimes a combination. And we'll do a whole webinar on treatment types at a future date. So with that, that looks like I've got the current burning questions. Let's get back to practice flow. All right, next questions to answer. This is kind of like the whole FAQ session. How often? How often should I graph? I'm betting a ton of you have wondered this yourself. In fact, if you've ever wondered that, just throw it in the chat window. Have you ever asked yourself how often? In fact, how often do you graph? Why don't you put that in the chat window as well? Do you do it every visit? Do you do it every 6 visits? Do you do it once and never again? Tell us what you're doing. While you guys are doing that and putting that in the chat window, I'll go back and read those, but let me tell you what my preference is. I like to always graph on the first visit. I want the baseline. I want, first of all, to establish a baseline for the patient. But secondly, I want the patient to establish a baseline expectation in their mind for what it means to come to me for treatment. I want them to realize and expect that I'm going to use technology, that I'm going to use tools that will show them, and that I'm going to spend time educating them. That way, after that first visit, they leave the office going, wow, that was a really great experience. I learned a ton. I got a report that shows me exactly what's wrong. It's a positive. It's a win for all the patients. Let's see what we got. Boy, these replies are flying in here. Every visit, every visit. Lots of folks that are doing it pretty often. Good. Okay, so I mentioned first visit. Now the next question is, when do I do the next one? Is it second visit? Do I wait 6 visits? I say always do it on the second visit as well. And the reason I suggest that is because you want to show change. Once you've done the first visit, you've established the baseline, you want them to see that stuff is happening. Yeah, I've only treated you once, and yet look at the changes we've made. Now, I've had people say, but what if it gets worse? What if the graph gets lower? And I don't blame you for being worried about that. Here's the answer that I like to give. Because, you know, maybe 20% of the time or so, the graph will get worse. It does happen. Sometimes you start moving chi, you start stirring up the system, it might get worse before it gets better. Look them in the eye and say, it's a good thing we checked. This way we know what to do. I'm glad that we have this information in front of us. And they're glad that you have it too. It makes the whole thing okay. It's not your fault that the result got worse. What it does is it makes you look like a very conscientious practitioner because you're going to do something to fix it. So, good thing we checked. So first visit, I mentioned. Second visit, I mentioned. My personal preference is to graph every visit and to have it set up in a flow in your practice so that it's already there, it's all ready, and the patient, just as part of the visit, knows to be ready with their shoes and socks off, ready to go. So 2 minutes, boom, you've got the graph, and then you can get started. During that graphing time is a great time to ask them how they've been since their last visit. Talk about symptoms and chief complaints and so on. That way you're not actually even wasting the time. You'd have to ask them that anyway. Why not be graphing while you're talking? And then you've got the graph, you've got everything ready to go. But because if you're treating them, things are changing, my suggestion is to graph every time. Now, having said that, I do know practitioners that will graph every few visits, and that's fine too. If that's what works for you and you're comfortable treating without that feedback each visit, then go ahead. Go ahead, that's just great. But I do want to make sure that you don't only view AcuGraph as a show and tell type of toy for showing people what's going on and convincing them that acupuncture is real, and now that that's done, we can put it away and do the real stuff. Fact is, you're going to give better treatments, you're going to have better insight if you are actually paying attention to what the graph says. Therefore, I say more often is better. And let's just jump over. Hey, Kimberly, if you're still on with this, why don't you tell us a little bit about how often do you graph? Do you do it every visit, first and second? What's your story?
Well, first I have to say, as I was reading all the answers, I was saying, yes, they read my blogs because they're graphing every time. Many of you know that graphing every time is really important to me, and I have definite reasons behind it. So graphing, well, I just kind of want to show you the flow. So on the first visit, I, of course, always graph, and that is the visit where I print a printed report. I like to hand the patient a colored printed report with my business card attached to it, my template attached to it, everything that they need. So when they leave and they go home and they show their family what's going on, then they've got a report of findings that they can share, and they can. I'm teaching them that symptoms in their body are related to imbalances in the graph. So I always do that on the first visit. I do not print a report for subsequent visits, and I don't even email it every time. But I do graph every time, and my patients expect it and they want it. If the first thing they do when they come in is they take off their shoes and socks and they sit up on their table and they know that they're ready for graph. I wanted to mention that you know, sometimes you get a patient who's real chatty and they're going to go talk and talk and talk and talk. starting the graph, that is the best time to start the graph because it puts them back on track of what you're there for and what's going on. So I let them keep talking while I graph and get moving on with my treatment. So I find graphing saves time, especially for chatty patients. After that, I do graph every time, and then I use graphing as a comparison, and I show from visit to visit what's happening. Around the third or fourth visit, I go into dietary, and then on about the sixth visit, if I'm doing them through a series, that's when I will give them another report. And at that point in time, I don't print the report, I email it to them. And over that 6-week period, as we are graphing them each week and showing progress, I don't need to give them a report every week of what's happening in the channels because we are working towards progress. I kind of want to give them a place where they land when we get them to their constitution, where they are constitutionally. So I graph them every time, and the graph to me tells me how the energy is imbalanced in the body. And I've written a lot of articles about this, but if I don't take care of the imbalances that I see that day, then I don't feel like my treatments are as effective. So if I am taking care of the disorganization, I guess that's the word I'm looking for, it tells me where chi is disorganized. And so I graph and I treat what I find in the graph, and then I do whatever else I do, but I do that every single time because as the body shifts, it shifts to a new disorganization. And then the next week it shifts to another disorganization. And I want to follow. I want to follow that pathway of where chi is going and where it's going to find its next blockage. And so I graph each time in order to show that progress and get the best results.
Okay, great. Thank you. I liked the tip, particularly about printing or emailing the graph on the first visit. You don't have to do it every time after that, although you may want to for certain visits, particularly if there's something really cool you want to show them. But once you've established that baseline, just seeing it may be enough. And patients learn how to read a graph really quickly. So they look at the graph. I've actually had a lot of patients that I'm graphing them and they can't wait for the results to pop up because they want to see how many greens they have. And they're going, yes, yes, look at that, you know, because it got better.
They can hear the graph and recognize, oh, that's high or that's low or, oh, wow. And so it's funny how many patients will look at your graph, look at their graph and say and ask me, am I doing better based on the graph? I like to teach them that they can check into their body to tell them how much better they're doing, but they totally trust the graph because it's a report, right?
Exactly. Exactly. Thank you. I'm gonna answer a couple of questions here really quick because we've had a few more questions come in on this topic, and I like the questions, guys. This is great. Thank you. Sedalia, I think it is, says, "Can I use electroacupuncture? Some points are painful for sensitive patients." The answer is absolutely yes. You can. You can use any type of treatment modality that works for you. Bill, what's the difference between the points list on the top line under the graph and those underneath under the graph? Good question, Bill. For those of you that are not familiar with what Bill's asking, I'm going to share my screen here again, and let me show you what he's asking about. Okay, so as you can see here on this graph, we have a series of points recommended here under the graph, and these are on the top line. Occasionally, though, let me see if I can find a graph with some bottom line points. Occasionally, you'll see some points on the bottom line, too. So at this graph right here, we have these points on the top and these points on the bottom. The answer is the points on the top line up meridian by meridian. So, for example, in this case, kidney 7, we're using that to treat both lung and kidney. And so kidney 7 lines up under lung and it lines up under kidney because it tells us what it affects. Large intestine 2 is lined up under the large intestine meridian, gallbladder 43, stomach 41. All of those are going to affect specific meridians. General points that affect the whole body or that affect multiple meridians will appear down here in the bottom line. So in this case, there's 4 splits, so it's showing spleen 21 because it's going to affect on a global basis, and spleen 21 then shows up under all 4 of the splits that it's going to treat. That's the difference there. So good question on that. Thank you.
Adrian?
Yeah.
While you have that graph up, something to recognize is that you have the second one over highlighted instead of the first one. So if it was the first one, it would just give basic tonification and sedation points. And because, oh, it actually did give spleen 21. Okay.
It does do spleen 21, but look at what happens with lung. If I put it on basic, then lung gets lung 5, and kidney gets kidney 7. But if I put it on advanced, it recognizes that kidney 7 treats both kidney and lung, so it eliminates lung 5.
Right, based off of 5-element theory.
Exactly. Yeah, based off 5-element theory and that mother-son relationship, which if I click right here on the point, then it will bring up the point information window, and I can see that mother-son relationship there, lung and kidney being in the Shen cycle. You can treat both with one point. So yeah, good point, Kimberly, thanks. It will automatically, on the advanced, which is this center square here, it'll give you a lower number of points if there is a way to do lower number of points. So let me jump back here, and we've got some more questions coming in. Dennis says, how do you set up your schedule so that you test each patient? We frequently see 3 to 4 people an hour. Wow, that's great. So testing each person each time would be very difficult. So I'm curious how you go about it. Dennis, my advice would be if you're that busy, you're doing 3 or 4 per hour, I would have an assistant and I would have a graphing station so that on intake, the assistant sits them down, does the graph, and by the time they're in the treatment room ready to see you, the graph is already sitting there on the computer, and you're ready to just get busy treating. Now, if you're in a solo practice and there are it's just you and you're maybe not seeing people as often, I would still have the graphing system all set up and ready to go so that you don't have to waste any extra time. When they come in, train them. You know, by the time I walk in the room, have your shoes and socks off, because the first thing we're going to do after I say hello is we're grabbing the graph probe. In fact, I'm going to do it while I say hello. That way it's not slowing things down. Thanks, Dennis. Good question. Sedalia says, a patient asked me if I could graph him just after treatment because he wanted to see the results. Did it happen to you? Is it right to do so? I do not recommend that, Sedalia, and here's why. Once you have treated a patient, you've moved a lot of chi around, you've stirred up the pot of soup, it's going to take at least a whole Horary cycle for everything to settle back down to where it's going to go and for all of the transfers to finish happening. Therefore, if you graph directly after a treatment, what you're going to see is probably a big mess. It's not going to show you actual results until it finishes treating, finishes the actual results, which might take 24 hours. So it's not going to impress most people. Acupuncture is not an instant wham bam, you know, I stuck it in, I did the needle, and boom, it's all done. You know that acupuncture takes time as the chi moves. So you just explain that to a patient, tell them that we'll graph next time and we'll see what happened as a result of today. Next one, Jen says, I've found very different results between reports for the same person. I'm at a loss for words as to how to explain this. Good call, Jen. Thanks for asking that. Fact is, people change. I tell people we are taking a snapshot of you right now. This is what's going on with you based on the lunch you ate and the sleep you got last night and the traffic jam you sat in trying to get to my office and the problem that you're worrying about with your kid at school and whatever else it is. I'm treating you in the here and now. And so you come to me, this is how you look, this is how I'm going to treat. And next time you come to me, your body will be in a different set of adaptation. There may be an underlying pattern that's the same, or things may have changed completely. But the whole point is we're here to restore balance. And this shows us the imbalance to restore. So it's okay. People get that things change. That's why you're monitoring it. Of course things change. So good question. Thanks. Annabelle says, why in the same patient in different sessions the pi gives a better result when the graph has splits? Okay, so ugly graph. And the next session, the graph is good, but the pi isn't. I get that question sometimes. Thanks for asking that. I'm gonna go back to my screen share. I want to show you some things in AcuGraph to answer that question. So give me a second here. All right. So here in AcuGraph, as I click through these various graph types, you'll see that there's a variety of different imbalances. Taking this graph that's in front of us, for example, we have 4 splits. 3 of them are small splits, okay? Pericardium, triple warmer spleen. Those are not particularly huge, but look at liver. Liver is a huge split. In a pi score, that's a bigger imbalance. You can't just say, oh, split is a split. No. Is it a small split or is it a really big one? Same with deficiency. If we look at kidney, it's rather deficient. If we look at gallbladder, it's barely deficient. So it's going to be scored differently. large intestine, lung, those are both excess, and those are both about the same degree of excess. But what if you had one that was just barely excess and you had another one that was up through the roof? So it not only takes into account the number of imbalances, the type of imbalances, and the severity of imbalances, but then it also looks at, for example, all the ratios. Upper-lower balance, left-right balance, yin-yang balance, overall chi stability, overall chi level. All of these things go into the statistical model. And frankly, this statistical model was so groundbreaking and took so much, we analyzed a couple 100,000 graphs to come up with this statistical model for how to do a pi score. We actually got a patent on it because it was that innovative. So to answer your question then, you can have a graph that doesn't look really bad, but could still have a poor pi score just based on the fact that, hey, there's only 2 or 3 imbalances, but they're kind of severe. Or you could have, 5 or 6 imbalances that aren't very bad, and the pi score may be better. Pi score is overall balance. So that was a lengthy explanation, sorry, but I hope that helps understand where that's coming from. All right, a couple more questions. Valerie says, how often are you usually seeing the patients that you graph every time? Kimberly, what do you have to say?
I like to take patients through a series. So if they're a brand new patient, I treat a lot of patients with chronic conditions. So when they come in, their graph is really messed up and they have a whole lot of problems. And I'll take them through a series of about 6 visits, because in 6 visits, I know that I can make a really big difference in their life. I'll take them from their first visit and just sort of take care of general imbalances that I see in the graph. And then as time goes on, I focus on multiple things. I want to focus on musculoskeletal, scar tissue imbalances, nutritional imbalances, finding out the type of herbal formula that they want. So to me, a 6-week period is my go-to number. And at the end of 6 weeks, I tell them, let's see what happens, and we'll reevaluate. I remind them that over that 6 weeks, they should see a difference in their chief complaint, and then I remind them that as we're balancing the graph, they're also going to see a huge difference in their energy level and their sleep and their emotions and everything else. So for them, it's like, yes, you can do all that. Sign me up, and they book all those visits.
Okay, cool. In terms of how often or how far apart the visits are, for me, it depends really on how acute the patient is. It's not unheard of to see a patient 2 or 3 times in a week if you're dealing with an acute problem. And if you're dealing more with something that's going to take some long-term to change, you might see them once a week for 6 weeks, like Kimberly's talking about. Wellness patients, you're going to want for a monthly visit, for example, where you just every month they come in for a tune-up, and that's great if you have patients like that, because that's something that you can count on with ongoing patients. It keeps your practice going. So really, I think, oh, go ahead.
One of the things I learned from Jake Fratkin is that if I was only doing TCM style acupuncture, that's why they treat almost every day, because they're not taking into consideration the disorganization in the meridians. They're just treating TCM patterns. So you have to treat a lot closer together. Personally, my strategy is based a lot upon the fact that I work at Miridia Technology. So I am 3 days a week working here, and I have 2 days a week to work in my clinic. So during that time, if I have somebody who is in acute pain, I will get them in more often. If you're coming in with sciatic pain, I want to see you. I don't want to wait a week. I want to make sure that I'm seeing you before that pain comes back to its top level. But if I'm treating you for chronic conditions, then once a week seems to be enough.
All right. Cool, thank you. And I just put up a poll, by the way, because we need to move on and talk about explaining AcuGraph and how to communicate with the patient. And I see somebody said, hey, can we talk about how to explain to patients? Good, we will. Just to finish up, Kate says, I don't do my best graphing when we're chatty. I have them be quiet and advocate for themselves. Let me know if I'm on the wrong point. A little embarrassing, but better than having wrong information or having to backtrack further when I realize what I've done. Good point. And if some people can multitask and mechanically just go through the graph and don't have to think and focus, some people do better when they think and focus. So yeah, you're going to want to do it the way that works for you. All right, so let's talk about how to explain AcuGraph. I'm going to give you a couple of examples of what I would explain first of all, for a first visit, and then for a follow-up visit, and then I'm going to talk about how to explain a PI score to a patient. Okay, all of this is how to explain to a patient. I've already explained to you guys as practitioners. So let me switch over here and show you what we're looking at. All right, and let's just start with, here's a nice graph. Okay, pretending that you're my patient. All right, Frodo, so this is great. I'm really excited that we've got this information because this really helped verify what I thought was wrong. I know you've had this problem for a while and you've been to various practitioners and haven't got the help. I think we found it. Here's what I'm seeing. First of all, on this graph here, you can see that we have different colors. Green is normal. Blue is deficient. That means there's not enough energy or not enough chi in that meridian. Red is excess. That's where there's too much. And then on this purple one, when we measured your left side and right side, they were really different. Each one of these represents one of the energy pathways in your body. And the energy needs to be flowing properly and all of it in balance so that everything can do what it needs to do. When that's interrupted, then you start getting symptoms. So let's take, for example, this one right here. SI means small intestine. I'm going to click that. You can see that the small intestine channel, it comes up, it's on the face here, and it's all the way down the arm. It actually starts down here on the finger and goes up in the numbers. Oh, whoops, I'm sorry. I guess the pop-up didn't show up. Then here's what we're going to need to do with that. Let me just change this over for you. I apologize that you can't see the pop-up screen, so I'm going to stop screen sharing. I'm going to change a couple of things and we'll start screen sharing again. So just a moment. There's that, and then we will do this. Sorry about that, folks. Okay, perhaps this is better, and let me go back to the graph that we were on. I realized that because of the screen resolution where I'm sharing now, things are possibly going to be funny sized, like the controls over here are going to be really small, but you can see the graph, and that's what matters. Now, which graph were we on with Mr. Baggins here? There it is. Okay, so I was talking about this small intestine channel, and you can see it gives us a pop-up here. And I can explain how this channel goes up the back of the arm, through the shoulder, and up into the neck and the side of the face. And, you know, perhaps this would explain, for example, pain here. And so if I were explaining this to the patient, I would say, do you see where this runs? Right through this area. You came to me because you're dealing with this chronic pinched nerve in your neck, and look at what we found. There's all this excess energy that's stuck there and not flowing properly, and so that's causing the inflammation, the pain, the tension that you're feeling there. Similarly, you can go through each of these, talk about symptoms, talk about locations, but it doesn't have to be really lengthy. The main thing I like people to understand is just this, that there are meridians, they need to be kept in balance. When they're not balanced, then you end up with symptoms. Explaining the PI score, I like this a lot because after I've shown them their balances, I say there's a lot of different types of imbalances, and all of the different colors and bars, sometimes that's going to mean a lot more to me as a practitioner than it's going to mean to you as a patient. So I've got this score for you. You scored a 55 on a scale of 0 to 100. You see 55 is in the typical range, but it's actually in the low typical range. And so with treatment, we're going to be looking for that number to get better because this tells us overall how well you're balanced and how well your meridian system is functioning. This big green circle here that's mostly green, you'll see some of them are not quite as green as others, and then you have some that are various shades of red. The more red it is, then the less balanced that channel is. Our goal is we want everything to be a shade of green. That means everything is working fairly well. And so as this score goes up, you're going to see this circle get more and more slices that are green in it. And that's it. We're going to watch the score. We're going to track how you're doing. That's more than enough explanation for the typical patient. On the follow-up visit, the way that I like to explain it is simply pop up the graph. We'll just pop up a graph here and say, okay, look, this looks really good. We still have some imbalance here and here. Now this isn't a real patient. These are all fictitious graphs, by the way, folks. So you're not going to see any continuity or pattern here. But with a real patient, you'll often see a pattern and point out what has gotten better. Hit the compare button, pull up the two graphs, last time and this time, and show how things have changed, and point to the differences that you see. People really like seeing that. They really like knowing their progress. And a comparison like this, that you just point to a couple of things for 30 seconds or a minute, is more than enough, and you're ready to treat. So there you go. That's a little bit about explaining the graph to the patient. One thing I would recommend, though, don't try to get really technical, and don't spend a long time explaining the graph. Here's what I mean. It's enough to say, in Chinese medicine, there are these different energy pathways, and each one controls something different in your body. We just need to make sure they're all working. And if one of them isn't working right, we'll find it, and we'll treat it. That's enough explanation. If you try to get off into technical things, or the physics of how a measurement takes place, or what galvanic skin resistance has to do with chi flow, you start to lose people. So that's what I wanted to share about graph explanations, and we'll turn it over. Kimberly, what do you have to add to that?
Okay, I am. Let's see. I'm going to talk to you about first visit versus follow-up visits versus monthly visits. So when a patient comes in for a first visit, I do what you typically learned in school. I do a full evaluation. I take down all their information, all their chief complaint. I look at their tongue. I look at their pulse. I look at everything that is included in normal TCM. And at that point in time, after I have done what they taught me in school, if you will, then I sit down and I tell them, and we do something a little bit different in our practice, and I want to teach you what that is now. So I have a picture on my wall, the typical naked Chinese guy with all the meridians running through its body, and I show them the channels, and I tell them that in traditional Chinese medicine, it was my job in schooling to learn how energy flows through the body, and I show them the meridians, and I tell them how the meridians are attached to the pathways that you see, internal organs and emotions. I give just a little explanation there, and then I tell them, the cool thing is that I work in a time where I studied traditional Chinese medicine, but I live in a time where modern Western society they've been wondering what Chinese medicine is all of these years, and they figured out a way that we can measure it. And I tell them that I have this system where I'm going to measure some acupuncture points, and I'm going to be able to show you on a computer screen what is going on. So that is how I transition right into the graph, and then I do my graph. Again, that part takes about 2 to 3 minutes, and when the graph is done, I explain that I explain what chi is, and I tell them that chi is this energy that flows through the body, and with modern science, we can actually measure how chi is flowing through the body, and I can show you on a computer screen. I don't have to get into a big, huge explanation in the way that I would with other practitioners. I just have to give them an understanding of what I'm doing, and that is enough. And they're like, wow, that's really cool. You use this modern science in your clinic, and that's exactly where I go from there. After that, I go into graph explanation, and I think one of the problems with practitioners is, especially new practitioners, they're trying to explain everything they know about AcuGraph to their patient, and taking every graph and picking it apart and explaining that to the patient. If I was a patient, my eyes would gloss over, because it's not my job to understand Chinese medicine. It's my job to come to you. You understand Chinese medicine. Just tell me enough so that I understand what you're doing and I can trust you and we can move on. So I'm going to bring up a graph here. Let's see. Can you see a graph on the screen?
Not yet.
Okay, give me a second.
Need me to come in there for you?
Nope, I think I have it. Now can you see it?
Nope, sorry.
All right. This just kind of shows you that even if you have technological program problems, you can still run AcuGraph. Let's see. I think you can probably see it now. Yes? Can you see a graph? Okay, perfect. Okay, so what I do when I am explaining AcuGraph to my patients, there are a couple of graphs that I focus on. So this patient, I've named it sciatic patient because to keep confidentiality, but it's a really great example patient. So the first graph that comes up is your baseline graph, and I explain to them that these are the channels we measured on your hand versus the channels that we measured on your foot, and I can then click on a channel, and I'm not sure. Are you able to see when I click? I know Adrian had made some changes. If not, I won't click. Can you see the small intestine channel right now? Okay. I can click on the small intestine channel, and you know what that looks like. You know that once I click there, I can show them the musculoskeletal portion of the channel and the internal pathways, and they really can relate to seeing the channel pathway and seeing the musculoskeletal. So the first thing I do on a graph like this is I just click on some channels. I explain that excess versus deficiency, and at this point I tell them, you know, what we want is we want energy to flow all the way through these meridians in an organized fashion, and when it doesn't, then sometimes there's too much energy in a channel and sometimes there's too little. And when there is too much or too little, that's when you come up with symptoms. And so I'm able to click on channels and show them what is going on. So my favorite graphs to click on are baseline, and from there I just click on some channels and show them pathways and talk about their chief complaint. My next favorite graph to click on is the energy flow graph. And this, to me, is a really easy way to explain Chinese medicine to the patient. It shows, I explained to them that if I was a drop of energy and I needed to flow all the way through your body, I would start at the lung and I would work all the way through, get to the liver, and then I would start back again. And from a graph like this, I could show this particular patient in general, I could show them how there's a blockage in the small intestine and the bladder channel, and then how energy dwindles down from kidney, it gets lower, and then pericardium and Sanjiao. So these channels here are really deficient. And so I tell them it's my job to fix these problems, but you can see how a problem or stagnation in one channel leads to more symptoms. And then at this point I tell them that I'm going to give them a report, and that I'm going to print it out. I tell them that you're not going to have all of these symptoms that are listed in this report, but it's going to help you to realize how I recognize imbalances in your body. So if you have deficiency in the pericardium channel, these are the types of symptoms that might show up, or excess in the small intestine channel. I tell them that I'm going to print this report for them, and I want them to take it home, and it'd be interesting if they circled the imbalance or the symptoms that they recognize in their body. And mostly my point of this is to help them understand that symptoms are related to imbalances and acupuncturists fix imbalances. So I want them to recognize the bigger picture of what is going on. So then we talked about modern science, we went to graph explanation. Really, that graph explanation part takes 3 to 5 minutes for a first time that I'm talking to someone. And then in that time, I've prepared the patient for treatment. I've helped them realize that symptoms are indicative of imbalances in the graph. And then I tell them that what I'm going to do is I'm going to graph you each time you come in, and with that, the graph might get worse before it gets better, and we're going to eventually get to a point where we get this energy organized. So I'm already preparing them that if the graph doesn't look amazing the next time they come in, they're not going to be shocked and surprised, and then I move on to treatment. I think that we have given you a handout of...
Yeah, I'm going to pull that up in a minute here.
Okay.
We've got... Kimberly's prepared a handout for everybody.
Can you see my face now?
Yep, we see your face.
Okay, perfect. So, so with that handout, that's the first visit. That's sort of the flow and the sequence that I use. When they come for their follow-up visit, the first thing I'm doing is I'm opening up AcuGraph, and I open up the notes and I start typing in, tell me about your last visit. Let's see if I can do there. I go to this patient overview and I go to the patient file. I've got a template that says follow-up and how are things since your last visit? And I start typing the notes in, patient, what's going on, and then I save that and I move right over and start a new exam. And so that flow happens really quickly. On the second time when I'm graphing the patient, I don't spend a lot of time analyzing the graph for them. I've already warned them that things are going to change, and I just need to look at a few things and move on into treatment as quickly as possible. When I'm treating, one of the things that new practitioners sometimes fail to recognize, when I'm treating, my first goal is to balance what I see in the graph, but that's not all I do. So I balance what I see in the graph, and then I add in any other treatment techniques that are specialty to me. So I am a TCM practitioner. I might add some TCM points. I was a massage therapist, and I do a lot of body work. I might add that in. If I was a chiropractor, I would balance the graph and then do a chiropractic visit. If I was a physical therapist, I would balance the graph and then do my physical therapy. So balancing the graph is one element to my mode of treatment, and then I move forward. Let's see, and then if you are a monthly wellness patient, you go through that same cycle, but here's the thing to recognize. If you're a monthly wellness patient and it's been a month since I have seen you, your graph is not going to look as good as the previous time that you came in because it's been a month and you're here for a tune-up. And so that is a really good time where you can begin to see consistencies that happen from graph to graph to graph. They tend towards a kidney deficiency, or they tend towards spleen damp or spleen excess, and so I recognize those types of things and we talk about them. But when I am doing a monthly wellness treatment, by the time they're not on their weekly series anymore, I graph them, I add notes, what's been different in the month, and then I tell them, it is so good that you are here. And then there are a few things that I look for, and I listed these on your handout. There are a few things that you can recognize and look for. One of them would be always look for the tendinomuscular imbalances, because if you can fix the channel at the tendinomuscular level, that's preventative medicine for the future. And then I also like to look for immune system imbalances. And we talk a lot about this in our advanced training, and you can take that advanced training and learn how to analyze the graph in that way. But as you can see how you put more time into that first visit, you've trained them, you're preparing them, and then as you come into subsequent visits, it really is 3 to 5 minutes, and it incorporates the notes and the graphing and asking questions, and it goes that quickly. I noticed there was a couple of questions over here for me, so I'm going to look for a second and let Dr. Larsen pop in.
Well, I'll pop in while we're preparing to do the Q&A stuff, because there's really only one topic left, but we've kind of gone a little over time, folks, because we've already answered a lot of questions, and some of them were really good, so I don't feel bad about that, but I am cognizant of your time. So the last thing that we were going to talk about today was, how do I make sure AcuGraph is adding to my bottom line and actually making my practice better, helping me be a more successful practitioner in terms of money, in terms of patients, in terms of all my goals. Rather than trying to go into that now and rush through it, we're going to save that for next time, if that's all right with everyone, because there's some great things that I want to share. And with that, I want to make sure you realize that you can download the notes Kimberly was talking about over on the side of your screen. And let's go ahead into the Q&As now. This is kind of open time. Feel free to stay as long as you'd like. We're going to keep answering questions as long as people ask questions, but we want to kind of focus, if we could, on integrating AcuGraph into your practice. Some of the things that we've talked about today. So with that, let me just, let's see. Julia says, explain a split if you could, just the theory of it. In brief, Julia, when you have the meridian on the left side and the meridian on the right side that are reading differently, the internal channel that connects the two together somehow has a blockage. They're not communicating. The two sides are not communicating, and they're not working in concert with each other. When that happens, then the meridian is impaired in its ability to do its job. Even if one side is working fine, the other side that's not is going to impair the whole thing. So that's just very brief, and correcting it is the most important thing you need to know. get it fixed. Don't worry too much about why, but watch for scars. Scars, especially midline things, can cause that. So correct that if you find it. Let's see, Genesia, no, Yesenia, thank you. I apologize. Says, Kimberly, do you have a 6-week program where you charge less, or is it still a per-visit price? Take it away, Kimberly.
Okay. I do offer a discount when patients want to pay in advance for treatments. Most people just pay week by week, and they just expect, because I planted in their mind right from the beginning that this is going to take some time. I asked them how long it took for their symptoms to get to this point. They are just expecting that it takes time. So don't feel bad about charging what you're worth for your time.
Excellent. Okay, Natasha says, what do you say if the pie is good but the patient feels awful? Now, I'd say by raise of hands, how many of you have run into this? But you can't really raise your hand. But when I'm teaching a class, that's just the first thing I would say, because this is a common one. You have a good-looking graph and the patient is half dead, or you have, on the other hand, a patient who feels great and the graph looks awful. In brief, here's how I explain that. The purpose of the meridians is to keep everything functioning. They have to adapt constantly. The day that you can't adapt to your environment is the day you die. Therefore, everything is adapting all the time. If you feel awful but your meridians look good, what it's saying is they're doing their best to keep things going, they're adapting, and frankly the fact that you feel awful means that they're not keeping up and we've got to give them some help. On the other hand, if you feel great but your graph looks awful, what that means again is that the meridians have had to go to extreme lengths. There's a lot of adaptation going on, a lot of imbalance going on, just to keep you feeling so good. You must have a very strong constitution to feel this great. And by treating these imbalances now, before you feel awful, we can prevent the results that would come if you walked around like this for a long time. It's a good thing we checked. We can stop this before it becomes a problem for you. What patient doesn't like hearing that? Hey, good news, we found it before it was a problem. Okay, Brian says, I have some pretty intellectual patients who are turned off by the report because it shows so many symptom possibilities. They say they have less faith in that kind of report. Not sure how to respond. Brian, I like what you've said. That's a good point. And obviously, you're going to have to be a people person. In this business, it's always about the patient and adapting to that patient's needs. So first of all, someone who's really intellectual, I would adapt to what I say and how I say it. But secondly, I like the word that you used. You said symptom possibilities. And that matters because these are the things that could be associated with this imbalance. This doesn't mean, Mr. Patient, that you're going to have all these things. It simply means that in Chinese medicine, these are the sorts of things associated. That's all it is. And it's an informational thing for you. It's not saying that you will have these, that you do have these, etc. And hopefully that'll click in their head and say, oh, I get it. Okay, this is explaining Chinese medicine to me. Okay, good, got it. But you're right. You can't please everybody. You're always going to have that one difficult patient that just doesn't get it or wants to naysay, and so do something different. Patrick, do you have a directory for referral of patients to doctors who use AcuGraph? Yes, we do. We have an online referral directory. We're in the process actually of upgrading that now for AcuGraph 5 users, and we're really looking forward to that. And that happens all the time. We have patients contacting us all the time saying, hey, I need an AcuGraph practitioner in Detroit or whatever. And so, yes, we regularly refer people to that website where they can find you. Let's see. Emma, when we get a split, how does it relate to TCM theory? Good question. Other than the explanation that I've already given about splits, Kimberly, is there anything you would add?
Yes, in my recognition of a split, it's when that channel isn't working to its full capacity and it's imbalanced. Oftentimes it'll show up as a split before it shows up as an imbalance between its paired organ. And so when you treat the luo point of that channel, you're actually pulling help. So if the lung channel is split and you treat the luo point of the lung, you're pulling help of energy from the large intestine over, so that lung and large intestine then balance out together. So it's just why it works that way, I don't know. My other theory on splits, a lot of the time, is tendinomuscular in nature. So my theory is there's a large intestine channel that goes up one side and there's a large intestine channel that goes up the other. And if you have an imbalance on that large intestine channel, you're on extreme on one side versus the other side, it's going to show up as a split. If you treat the luo, you're going to bring energy from the lung over to help that large intestine split, and then you can also work tendinomuscularly. I wrote a blog a while back about a guy who had a spider bite on the large intestine channel, and it was this huge imbalance. Oftentimes I'll see splits when there is sciatic pain in the gallbladder, or if they tend towards headaches in the gallbladder channel, or extreme shoulder pain in the gallbladder channel, or the hip pain. So if you look at the whole channel pathway, oftentimes it's blockages tendinomuscularly in nature. So you could go back and forth between TCM and tendinomuscular.
Okay, cool, thanks. One other thing I'd add, just for your GWiz file, a split is not a new invention because people have had splits since time immemorial, but with typical TCM, you know, when you're doing pulses to figure out what's going on with the meridians, you're not going to pick up splits because there's not a way to measure left versus right for a single meridian. So it wasn't until electronic testing came along that a split was even a thing. And therefore, when you say, well, how does this really apply to TCM theory, part of what you have to realize is that when you're going to go back and look in the classics, you're not going to find it because it was just never a thing. There was no way to even account for that. So it's kind of a new deal, and all we know is it seems to work. So good. Why are low points used for splits? Well, Kimberly just addressed that one. Lenny says, would it be possible to mark on the treatment plan whether I use laser or moxa or Twina, as well as, or instead of needles, instead of having to write another note? Good suggestion. That might be an interesting one to look into. Right now, of course, obviously, you would have to write a note for how you treated the points. And that would be easy to do, just right there under the treatment plan, just dash off a sentence. But good suggestion, Lenny. Thanks for making that. Jane says, I had a patient who always graphed me very high. Or no, always graphed very high. He had RA and was on a lot of medications. He felt better over time with acupuncture and herbs, but I never felt like AcuGraph helped me with him over time. I've noticed other patients over time on lots of meds read high. What are your thoughts? That's a great point, Jane. When patients are on a lot of prescription meds, that tends to mess around with stuff, and that can affect graph readings. It can cause things to read high. It can cause, also I've seen where it causes things to read low. And just like the prescription meds, particularly taking a lot of prescriptions, it can wreak havoc in a lot of different body systems. It can do the same in the acupuncture meridian system. I would love to tell you that AcuGraph is going to be the bomb for every patient every time, but of course we know that's not true. You're always going to have one or two exceptions here and there. But I'll tell you, for most of the patients, most of the time, AcuGraph is going to be a tremendous help. And isn't it great that you've got other tools and other ways for a patient like this one? So thanks for bringing that up, Jane. One other one I get asked, this is kind of funny. Every time I teach a class, somebody says, what if your patient's missing a leg or missing a limb and you can't graph? And I say, okay, well, if they're missing a limb, then graph the other limb and just duplicate the numbers, manually type them in. At least you'll get some approximation. And then there's always a smart aleck that raises his hand. Well, what if they're missing both legs? Well, don't graph them. You can't, because guess what? They're not a candidate for it. So anyhow, Christine says,
this is a good time to find out on the forum, because if you're in the forum, we got that question this last week, where there's an amputee with no legs. So on the forum in Facebook.
That's right. So yeah, if you own AcuGraph 5, then one of the benefits you have is being part of the AcuGraph users group on Facebook, where you can ask these questions, post graphs. People do it all the time. It's very active over there, and a lot of practitioners helping one another answer questions, putting up cases. It's really great. So join the conversation there if you're not there.
We'll put up a link.
What's that?
We'll ask Cameron to put up a link.
Yes, Cameron, would you mind putting up a link? Thanks. And then Christine says, can we do just auricular therapy based on the scan? The answer is yes, you can. And actually, in AcuGraph, one of the treatment options that it gives you is an auricular treatment option. Although I find that you'll have better success balancing the graph using points on the body. And then I like to use auricular points for treating symptoms. It's a root and branch treatment. You can get some really great results with that. And if you're not balancing the graph, if you're just graphing and then going and treating symptoms the way you normally would, the next thing that'll happen is after a few months you'll call me on the phone and you'll say, why aren't my graphs getting better? And then I'll ask you, well, what points are you using? The reason I say that, kind of tongue-in-cheek, but I've actually had that happen quite a bit, where people are only using it as a show-and-tell toy, but they're not even paying attention to what it actually recommends, and then they wonder why the graph isn't getting better. Well, logically, you need to do what it recommends, and you would not believe the number of people who've called me back after a couple of weeks and says, I would never believe it. Those are points I never would have used, but I started using them, and the graph got better. And you know what? My patient got better. And so that's what we like to hear. All right. Don't see any other any other questions going on right now. So we're going to go ahead and bring it to a close. I want to say thanks to everybody. I appreciate you being here. There will be a replay available. Don't forget to download the notes if you haven't downloaded them, because we're about to close it. And we will see you all next month. Meanwhile, hope everybody has a great Thanksgiving, and we will talk to you soon. Thanks, everybody.
Thanks. See you later.